Everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. People are still gathering here. We got a good size crowd that has signed up for tonight. We'll have to see how many people actually show up. So the way that these webinars work, I think many of you know, we're hosting it on the Zoom platform now, which gives me a chance to interact with you if I need to. But to give me the greatest chance of getting through as many questions as possible, I'm having people write their questions to me in the chat box. So use your chat box to write the questions to me. That way everyone else can read them too. I will read them out loud anyhow, but I do want, it just gives me a quicker way to go through it, okay? When you do write your questions, make sure that you send them to everyone. And then I also ask that you only use the chat box for asking questions tonight, okay? All right. As usual, I am creating and recording tonight's webinar, and my intention is to have it edited and a synopsis created for it and have it out to you by around 9 to 9:30 a.m. Central Standard Time tomorrow. You will find that in Lyme United on the left-hand navigation menu under the Zoom recordings menu. That's where I post those, okay? So if you have any, want to come back and hear parts of what we talked about, and those videos are actually time-stamped based on the synopsis that I give you too. So you'll be able to follow along. If you want to hop to a certain section, you can, okay? So I'm going to read the question, I'll answer it, and then I will ask the person whose question it is if there's anything else they want. And then I will also see if any of you all have questions or points about that question. Okay. So when I do that, when I open it up that way, don't ask an unrelated question, only things that pertain to the question that I've taken there. All right. All right. So I think that's it for my background section here. Let's go ahead and get started. So Catherine says hi. Hi, Catherine. Good to see that you're here. Let me get rid of that. All right. Next question is from Jim. Hi, Jim. Good to see you here again tonight. Let's see. Hi, Dr. Ross. Thanks for these great webinars. I'm hoping you can help me figure out what's going on with my health situation. I probably still have Bartonella and Borrelia, though it's hard to know, as I agree with you that retesting to try to find out what is pointless. On the one hand, my energy and ability levels slowly improve, which is good considering that it usually goes the other way when you are 62. I'm 62, I get that, don't worry. On the other hand, I've had a series of health issues in the last 5 years with my right elbow, right wrist, urinary tract, right ankle, and now left shoulder. Sometimes I wonder if this is my body's way of slowly getting around to dealing with pockets of infection in various parts of the body. Is this a possibility? Have you seen this pattern before in your patients? So Jim, I want to look at something you wrote here, and then I'm going to actually have you open up your microphone so I can ask you something here. Okay, so so I understand that in a lot of ways you have gotten better with the better energy levels. Has anything else gotten better for you over the last years?
Just generally, I slowly get able to do a bit more. Generally, just pushing out a little bit at a time,
Okay. And then these joint issues, as well as the bladder issue, have they been there and they're just not responding, or are they new issues that have developed as other parts have gotten better for you?
Okay, it's like 2020 was the wrist, 2022 was the elbow, then it was the urinary tract, then it was the ankle earlier this year, then it was shoulder later this year. It just seems like things just keep popping up.
So over the time that your energy has gotten better and thinking has gotten better, you've still had new joint pain areas showing up and a bladder issue show up. Is that correct?
Yeah.
Okay. How physically active are you? Are you exercising at all or not?
Yeah, I can exercise quite a bit. I do. I'm doing a lot of exercises for my shoulder for one thing, but like for today, I'm in Ottawa, Canada, so it's cold here. So I walked down to the local rink. That's about a 10-minute walk or so. Went skating for about 25 minutes. Walked home for 10 minutes. I'm fine.
Okay.
So I can do a fair amount of exercise.
And then are you still treating for Borrelia and Bartonella? In other words, are you using germ killers for those still?
Well, I take Cemento every day, like a dropper full twice a day is sort of like a policeman kind of thing, especially for the Borrelia. And the Bartonella a little bit every now and again, but it seems it's in my shoulder. So if I take Bartonella killers, it seems to make my shoulder worse. So I'm
Yeah.
kind of hesitant to do much there. I just kind of do a little bit.
Okay. Okay. So with that, I would just briefly from what you said, these are my observations, right? Which is not the same as me doing a full visit with you and really trying
No,
to
for
get a
sure.
comprehensive understanding. All right. So, but I do wonder, I understand that you treated for a while to get the Bartonella and Borrelia germ load down, probably with herbal or prescription antibiotics, right? I
Correct.
still wonder, given that you've got new areas of joint pain showing up, if you still have some germs around. I just wonder that.
I'm pretty sure. No, I'm pretty
Yeah,
sure I do. I'm pretty sure
yeah,
I see. I get a lot of stripe rashes around my
yeah,
shoulder, especially.
yeah, yeah. So
Um,
if you don't want to go with herbal or prescription antibiotics, there is another thing you could try, which is to try to work to get your immune system to kick in a little bit stronger to help you keep these germs down, and also consider doing some things to repair and control the inflammation, or repair the joints, repair your bladder, and get the inflammation under control. Okay. So one thing to consider using would be a peptide called BPC 157. BPC 157 is a peptide that's made within our stomach linings. It has a variety of functions. It can improve mitochondria function. It can aid in repairing injury to joint tendons, muscles, cartilage, nerves. It can repair things. In addition, it modulates the immune system to try to get a better balance between what's called Th1 and Th2 inflammation. Th1 is the immune system that fights infections. Th2 is your antibodies and mast cell parts of the immune system. Okay. And if these aren't in balance, if one gets a little out of balance, you can get more inflammation from that, basically. And BPC 157 can help with that. It's kind of the starting place if you're going to work with peptides, because it does so many things. It helps mast cells, it helps balance Th1, Th2, it does tissue repair, helps with neuropathy, helps your mitochondria work better. Okay. All right. So you could do that as one pill twice a day. Integrative peptides makes a short acting and a long acting. For this type of a situation, I would do a long acting. They're a delayed release one. Okay. The other thing you might consider looking at, so I look at BPC 157 as the starting point for a peptide treatment, because it just does so many things. And often just taking that alone is going to be enough to quiet everything down, get your immune system working better to fight the infections. Okay. Well, let's say you do that for about a month or two and you're still having this wandering pain and just still not getting all the way there. Then the next thing I would do is I would add another product, and it's a product called Thymogen Alpha 1, which is
right.
also by Integrative Peptides. And what Thymogen Alpha 1 has in it, it's got two what are known as bioregulator peptides. So the BPC 157, by comparison, is a type of peptide that I would call a messenger chemical. It's a messenger that goes to cells, interacts with a bunch of receptors on the cells or inside the cells, and causes a bunch of other chemical reactions. It's a messenger. It causes things to happen, okay? Bioregulator peptides, on the other hand, are usually 2 to 3 amino acids long, so they're shorter than like a BPC 157. And what they do is they get into the center of the cell, into the nucleus of the cell where the DNA is, and they help that DNA, they regulate how that DNA is expressed, or we call that the epigenetic presentation or epigenetic factors of how that DNA is translated. Is it not translated? Is it translated? How quickly is it translated? All that stuff. Okay. So bioregulators kind of create balance at a genetic level, the genetic expression level. And so Thymogen alpha 1 has two bioregulators in it, and it can mimic the actions of a peptide product that the FDA no longer allows to be used by compounding pharmacies here in the States, called Thymosin alpha 1. And Thymosin
Right.
alpha 1 was well known for fighting and helping with infections and getting the immune system balanced. Okay. We don't have that one anymore. So this bioregulator product is kind of a replacement for that. And so what it does, it can help. It also helps balance Th1, Th2, but it does so by helping to elevate a type of cell called T regulatory cells. T regulatories are the parents. They control how much Th1 you have, how much Th2 you have, and something else called Th17. They create balance in all these inflammatory pathways we have, okay? So Thymogen helps improve those T regulators, which get your immune system really revved up to fight infections, but also it helps quiet inflammation as well too. And if you were to do that, that would be 2 pills 1 time a day. So what I'm proposing is maybe not going to antibiotics at this point. I understand that flares you up in your shoulder, but what I'm suggesting is maybe work through a peptide program for a bit and see what that might do for you, effectively trying to get at your immune system to work better. And that BPC 157 again can help do tissue repair as well too.
Yeah, that sounds good because really, I mean, my immune system does get the job done, but it takes a longer than it should.
Yeah. So tomorrow I'm putting the finishing touches on a rewrite of my article about how to use peptides, where I get Integrative Peptides has come up with a bunch of new products here lately, so I needed to update my article to match what they're doing. And a number of things they're introducing are these bioregulator peptides. And so in addition to that Thymogen alpha one, they now have a bioregulator product for your pineal gland, which regulates your circadian rhythms and sleep. They now have one for your thyroid, something called Thyroid Pep. And they have a new one called Cognipep, which is aimed a peptide regulator product that is aimed at improving brain function. You may be familiar. They also have another product called Cerebopep. And the difference between that Cerebopep and the Cognipep is Cerebopep has in it cerebalysin, which is a messenger peptide that through a bunch of chemical reactions can repair nerve injury and prevents nerve injury when you're having toxic or trauma or infection exposures. Okay, so cerebalysin, it protects and repairs the architecture. The Cognipep, on the other hand, is a bioregulator, improves the functioning of the brain. Okay, so think of cerebalysin as something that can repair brain damage from infections, the architecture in a sense, or head traumas, versus the Cognipep is just basically you would use, if you think you have normal structure, then you would use the Cognipep to improve thinking. All right. Now, sometimes you need to do both, but anyhow, so you'll see tomorrow I'll have a whole article. I'm hoping to get that article out tomorrow. I was close to having it concluded today. I just didn't get it all wrapped up yet.
Right. Yeah, that's good. One of the reasons why I was wondering if it was my body sort of getting around to things slowly is because about 5 years ago is when my sort of life situation got stable.
Yeah.
And it was kind of unstable before that. And just as soon as things got stable, I started having these issues, which I didn't have before. So it kind of made me wonder, is that what's going on here?
Yeah, it may just be immune dysregulations set off by the infections, and the infections still being there. But so that what I'm going to try to see if you can go at it from the immune system level.
Yeah, actually, I was thinking BP 157 is kind of the next step, so you confirm that.
Yeah. All right.
Okay. Thanks a lot.
Yeah. Good luck to you,
Okay,
Tracy.
bye-bye.
I see you got your hand up here.
Hang on.
There you go. Hi, Tracy.
Hello. So you just said something that was news to me, that BPC comes in short and long acting forms. I wasn't aware of that. And could you, if I've been buying BPC for a long time, which have I been short or long acting, and which would you use when?
So what the Integrative Peptides keeps changing their formulations, which is maddening because sometimes you can't. You read the bottle label, it's like, oh my God, they changed something again. But anyhow, so they have on the front of their pills, they have on the product I carry their delayed release pills. Okay. But when they first started making this stuff, it was all immediate released. Then they went to this delayed released and stopped making, and they originally never put a label on. They didn't say on the label immediate or delayed. It was just, you had BPC 157, it was probably all immediate release. They reformulated to get delayed release, and so they're pills now. On the bottle, it will say delayed release, okay? But in addition, there is a peptide spray, BPC 157, which is immediate release, because if you're spraying it, you're absorbing it right into the bloodstream, all right? In addition, and I don't carry this, but I'm going to be doing so, they now have pill forms of immediate release. Okay, so on the pills, the label will say delayed release or immediate release on the label. At my store, I'm going to change my product so it's very clear. It says delayed release or immediate release. The pill form I have right now is all delayed release. All right. The spray is immediate release. That's how the spray works, basically. And I think that the immediate release to me is probably better for sports injuries, which is more acute problems. The delayed release, I think, is something better for chronic ongoing problems created by infections and toxicity, et cetera.
Okay.
Yeah.
All right. Good to know. Thank you.
Yeah. Good luck. Let's see. Katie, I see your hand up there. Hi, Katie. Oops, we need your microphone on there.
There we go. Now, can you hear me?
Yeah, plenty fine. Yep.
Okay. And I don't know if this is a follow-up question or if I should make a separate question, but it's kind of related to the BPC. Would that be something to try before trying IVIG, since it helps modulate the immune system?
It depends on what you're trying. So I'll take that question. That's fine. It's a follow-on to this, what we're talking about. Yeah. So but thank you for considering that. So I appreciate that. So it depends on what you're trying to use the IVIG for. What condition are you trying to use it for?
My son has been treating Lyme, Bartonella, mold toxicity for like 3 years, and we just can't get rid of his fatigue.
Yeah.
And his IgG subclass 3 is constantly low, and some other things are always low.
Yeah, so you have a different problem. So
his doctor said, see to an immunologist, but that's been a challenge.
Yeah. I think in this situation, this is just experience as well too. I think you're probably going to be better off going with the IVIG.
Okay.
I haven't seen the peptides be able to. It sounds like his immune system is deficient in its ability to make this class of antibodies, and that deficiency of one class isn't something I've seen respond to peptide therapy before.
Okay. Thank you.
All right. Good luck to your son.
Thanks.
All right. All right. Let me see here. Let's see. Simichek, I see you waving your hand there. Let's see. I need you. Yeah, click your. There you go. Well, nope, not yet. It's not unmuting you for some reason.
Can you hear me now?
Oh, there you are.
Yeah.
There you are.
Yes. Yes. I want to follow up on the peptides because I am new to these meetings. I listened to about 2 prior and I studied your work.
Sure.
I am looking.
So first of all, welcome here.
Thank you. I am looking for peptides as an option to lower inflammation. My problem is the opposite. I am overreactive to everything. And I treated MCAS, which I thought it was the first culprit, and I'm taking everything for that. Despite that, MCAS being taken care of, the moment I really engage in a serious treatment or killing, the inflammation goes out of proportion. Just recently, I am immobile with my hand and swelling, fluid is on my heart. So it's kind of, I am stuck because my doctor is not very fond of steroids, but I really don't know where to take it from here because what anti-inflammatory, is there a chance peptides might do something? Because my IgGs and immunoglobulins are all okay.
Yeah, so let me give you some ideas.
I have
here.
Babesia, Autophagy, Bartonella, Lyme, and relapsing fever, all of them.
Got it. So, and it sounds, to clarify, it sounds like when you use antibiotics, whether they're herbal or prescription, you flare up quite a bit. Is that what I'm understanding?
Especially anti-malarians. It almost like I'm opening a Pandora box. It looks like that Babesia is keeping everybody in check, and it's riding the bus. And the moment I start to attack it, they are coming with a force, and not one after another. They are coming at the same time.
So so in all likelihood, that severe reaction you're having is something called a Herxheimer reaction, which is as you start killing the germs, your immune system sees the dead bug parts and makes more inflammation chemicals called cytokines. Okay.
Yes.
So
Yeah,
the
I do
front
know.
line, so your front line of defense at controlling cytokines before even looking at peptides is to make sure you're taking herbs that get inside white blood cells that limit cytokine production. My favorite one is to use curcumin, which is
I don't tolerate that one. I don't tolerate it for some reason. My body doesn't agree with it. I'm taking Boswellia, and I'm taking the AKBA, and I am taking herbally the from Burner, I forgot, but that is still insufficient. All of it is insufficient.
The other one to consider, which will also help stabilize your mast cells, is quercetin. Have you tried that one before?
I am on ketotifen, dehist, I'm Laxanovox, high doses of vitamin C, and Allegra.
So I hear
And
that. Let me talk to you about quercetin real quick. Okay, so quercetin is a mast cell stabilizer. The ketotifen you're on does two things. It's a mast cell stabilizer. It stabilizes the mast cells so they don't release histamines as easily. The ketotifen is also an antihistamine. It will help block the histamines released. Okay. Quercetin is an herb that has two things that may benefit you. One, it also gets inside white blood cells to limit cytokine production. In addition, it helps stabilize your mast cells too. So you might get a little more help with the mast cell activation, okay? But to limit this cytokine surge, I would consider doing the quercetin. It's usually a 250 milligram pill, and you'd want to do 500 milligrams 3 times a day.
But the quercetin is in the DHIS supplement already, which I am taking.
Oh, it is. Okay, then all right. If you're taking it already, then great. Okay. All right. Second thing. All right. So that is helping limit cytokines. Okay. Second thing that can help. Second thing that can limit cytokines is to take glutathione. Are you taking?
I'm taking that IV twice a month, and then I'm taking the one which is sublingual, and still not enough.
All right, so you're doing the first line of treatment that you do to lock cytokines down. That you're doing that, okay? All right. Then in situations like that, my next step would be to add in the BPC 157, the peptide, okay? Because that is going to work to control what's known as Th1 and Th2 inflammation, which are making these cytokines, and it will also help do tissue repair. It's going to help your mitochondria. I would start at 500 micrograms twice a day. I would do the delayed release variety. All right. And then in about a couple months, if you're still super reactive, I would then add in the peptide called KPV. That's also made by Integrative Peptides. That peptide stabilizes mast cells and in addition is anti-inflammatory.
What about the VIP peptide, which I read recently that also has a lot of anti-inflammatory properties?
It does. I have not found it useful in this kind of a situation.
Okay.
Yeah. Okay. So that's where I would suggest going with peptides with you.
Thank you very much.
Good luck to you. Okay. All right. Let's see. Make sure I don't have any other questions here. Nope. Okay. So let's go on. So Jim, thank you for your question, and everyone else, thank you for your follow-up questions there. All right. Next question is from Carl. So let's see. Carl says, before I start Prolon, everyone, is a type of diet called a fasting mimicking diet. And when you take the Prolon, it basically tricks the body into thinking it's fasting. You still get some calories, but the diet has in it certain amounts of amino acids, fats, and carbohydrates that you get, and in an amount that you get that tricks your body into thinking it's fasting. So you get all the benefits of fasting, but you don't have to eliminate all calories. Now, you're still going to have daily anywhere from about 700 to 1,000 calories a day, so it's very low, but it's designed in a way not to stimulate your food sensing pathways. And the benefits you get out of it is you get cellular rejuvenation. It triggers a process called autophagy, where your cells get rid of garbage that has built up, especially in infections and in aging, and helps clean them up, okay? The second thing that it can really do that is useful in treating tick-borne infections, even mold toxicity, is it can aid in getting rid of what are known as senescent cells. And senescent cells are cells that stop dividing. And that happens as a natural part of aging. But in addition, when you have a lot of toxicity and you have a lot of infections, that can stimulate your cells to shut down and stop dividing too. And when they shut down, stop dividing, they become cytokine production factories. They just dump out inflammation chemicals right and left, okay? So doing a Prolon fasting mimicking diet for 5 days can help clean out some of those senescent cells as well too. All right, so that's just background on that. I'll show you in a minute an article I've written about it. But what Colleen wants to know is, does she need to stop some of her supplements when she's doing this? And she lists them all out here. So these are ferrosorb, magnesium, 2 types of magnesium, psyllium husk, carnitine curcumin, ginger root, D3K2, pure encapsulations, DGL+, zinc, vitamin C. All right, and then there's a fresh ginger root, fresh lemon juice, dried dill, dried parsley, pink sea salt. All right, so my comments are, anything that has calories in it, you should stop. All right. And as I read your list, ginger root, fresh lemon juice, and dried dill would be the only thing that's going to have calories in it. The other supplements you're on, I do not find to have caloric components. In other words, they're not going to confuse, they're not going to add calories and pull you out of this fasting mimicking state. Okay. Another thing to consider for those of you that are wondering, well, what about me? Any of your tinctures that have alcohol in them, you would need to stop while you're doing this. Alcohol has calories. Any product that has fats in it, so liposomal products, those fats may be enough that they have a caloric intake that you would need to stop as well too. Okay. So that's just kind of a general guideline there, basically. All right. All right. Colleen, did I answer your question for you?
Yes. I just want to make sure I caught it. So you said the lemon, the ginger root, and the dill. Is that what you said were the 3 things that might not be good?
Yeah. I would probably pull those out.
Okay. All right. Sounds good. Thank you.
Yeah. Good luck. All right. Do I see any other hands up here? I see Mark. I see your hand up there. Yeah.
New to the group. My wife is a big fan of the Prolon or fast mimicking diet, but and I wanted to do it, but my weight has plummeted recently, and I'm probably underweight, too underweight to try that. Do you have any suggestions for how to safely do the fast mimicking diet without losing too much more weight? Thank you.
So what I'll let you know is an average amount of weight loss that can occur is about 2 to 3 pounds. So, and I don't have any way of knowing what the rest of your health is like to be able to say whether you could tolerate 2 or 3 pounds. I just don't know. Yeah, so I can't comment because I don't know enough about your health to say whether it'd be okay to still lose 2 or 3 pounds.
Okay, 2 or 3 would probably not be the end of the world, but it's getting pretty close to about 115 or so. So that's probably not ideal.
Are you working with somebody to figure out why you're losing weight?
Yes. So I had a question in the chat coming up, but Bartonella, Babesia, possibly Borrelia, most likely, mold toxicity, all in the process of investigating. So
okay. You might want to hold off on. So I like using a Prolon diet or a fasting mimicking diet when somebody has gotten some control of their infections and toxicity first. So because I use it as a way of repairing injury after you kind of starting to get some control on those things that are doing the injury, basically. So I might suggest just holding off on that for a bit.
Okay, thank you.
Good luck to you. All right, let's see here. Mary, you're next here. Hold on just a minute. I'm getting rid of Colleen's questions here. Hello, Mary. Let's see. Is treatment with lumbar kinase recommended for all strains of Babesia? How soon after starting treatment would you introduce lumbar kinase? I'm asking for my son. It started atopiquone and Zithromax in October. Thank you. All right. Hi, Mary. Good to see you.
Good to see you.
Yeah. So it's a good question, actually. So the main strain that we're worried about, and the reason, well, let me start over again. So lumbar kinase is used to break down fibrin, and Babesia has the ability to wrap itself in fibrin, which is your blood clotting proteins. And when these fibrin and Babesia get mixed together, they get stuck on your blood vessel walls, and they're harder for the immune system to get at, and they're harder for the antibiotics to get in. Okay, all right. And that is something called sequestration. So these germs get sequestered away. So, you know, the person that's done a lot of work looking into Babesia strains and their effects is a guy named Dr. Harry Lindner. And he's been trying to describe to all of us at iLabs for a while that our bigger problem are with strains that are sequestering strains of Babesia. And newer science is starting to bear him out. Actually, there's some interesting science that's starting, because he was kind of we all looked at him kind of skeptically for a bit, but he's actually, I think he may be on something. So and so a lot of chronic Babesia may be caused more by these sequestering strains. And the sequestering strain that we know of is a strain called Babesia oticoli. Okay. Now, the other two strains, the only two strains that we actually have the capability, well, that's not true. There's 3 strains that we have the capability of deciding if they're there. Those 3 strains are Babesia microti, Babesia decani, and now Babesia oticoli. Okay. Microti and decani do not appear to be sequestering strains. The oticoli does. All right. Now, if you've had Babesia testing through IGeneX, more recently, their method of testing called the immunoblot which is measuring antibodies against Babesia, can detect whether you have antibodies against microti and decani, and it also can detect whether you have antibodies against the family of Babesia, which includes oticoli. But their test does not tell us whether you have oticoli for sure or not, okay? So if you have a positive, what's called genus test through IGeneX, that means you have antibodies against the family of Babesia, there's a good chance it could be oticoli. In that case, I definitely would use lumbar kinase, okay? If you are treating a microti and a decani and not getting better, say at 4 to 5 months, it's possible you got another strain in there, like an oticoli, and it just didn't show up in the testing, in which case I would add lumbar kinase there. So typically in my treatment approach, I say usually months into treatment, you want to add lumbar kinase. And I would clarify it even further. I would say if you're not getting better, say 3 to 4 months in, even if you know you have microti, even if you know you have decani, think about you might have a strain of oticoli that didn't get picked up. All right. Now, there are 2, there's a lab system called T-Labs that's doing a microscopic exam of your blood, and they've got a marker that attaches to Babesia oticoli. So they can see under the microscope if you have oticoli. It's a direct testing method. The trouble, and also IGeneX has a direct test called a FISH test, What I mean by direct test is you're literally seeing the germ. All right. So, and so their direct test at IVIG is called a FISH test. They use a fluorescent marker that attaches to the germ. Their FISH test is a genus test. It can look at all of Babesia. So when that comes back positive, it could either be Autocoli, Microti, or Decani. All right. But if you have known Autocoli, and the only lab that's able to tell us right now is the T-lab test. If you have known Autocoli, definitely would be on leber kinase. If you have, again, if you're treating for Babesia on a genus test, it came back positive, or if you have symptoms of Babesia and that's why you're treating, if you're not having any good budging by 3 to 4 months, add leber kinase in, because perhaps it could be Autocoli is the cause. Okay. Did that answer your question for you?
Yes, it does. Thank you very much.
Yeah. Yeah. Good luck. Good luck to your son.
Thank you very much, Dr. Ross.
You're welcome. All right, let's see here. Oh, let me do a quick, actually, let me do a screen share here for a minute, and then I'm gonna come right back. I see there's 2 hands up, but let me do my screen share here first. All right, so I wanted to show you all, I mentioned the Prolon diet earlier. And so I have an article that I wrote about fasting mimicking diets and what the benefits are, okay? And although I talked primarily about rejuvenating cells, there's a bunch of other benefits. You can read about it here in this article, all right? And then if you do want to proceed with that, for our US citizens, and I'm understanding that this does not work for our non-US citizens, I have a Prolon diet page at my store, which is basically, I'm an affiliate for this company. And if you click on my link here, you literally are buying it from the company that makes the diet. But there's a substantial discount if you click through me to do that. Okay. So I just wanted to show everybody that as well, too. All right. All right. And then if you're looking for ways to treat Babesia Autocoli or the various Babesia species, let me just show that to you here for a minute. You're probably all aware of this, but take a look at my article called Kills Babesia Brief Guide. And in here, I do talk about treating Babesia with what are called quinoline treatments. And these would be the ones that are better for treating Babesia Autocoli. And that would be to either use a treatment that has primaquine in it or tafenoquine. Tafenoquine probably is the stronger way to go. Okay, so I just want to point that out to everyone as well, too. All right. All right, let me go back here. All right, Tracy, I saw your hand up there.
So about Babesia Autocoli,
Yeah.
if you had we had a family member that had, this was the immunoblot, positive for Microti, negative for the family,
Yeah.
Which seems strange to me. It's like saying,
yeah,
the family member is positive, but the whole family isn't. But when we contacted them, they said that's normal. That was not a faulty result. So
let me just say something briefly about that. So the IVIG testing is 95% sensitive, meaning it will pick it up if it's there 95% of the time, but it will miss it 5% of the time. Even their genus test, even though you obviously had the strain test was positive, the genus test will still be wrong 5% of the time when you have it.
Okay.
Yeah.
So is it ever the case that something in one of the sequestering forms might turn up as Microti, or can we trust that Microti result as being positive?
And hearing from IVIG and Dr. Shaw, who's the head of IVIG, they think that their Microti test is very specific for Microti, that there's not cross-reactivity over to Autocoli. On the other hand, there is some evidence when you've tested positive through IVIG for the Decani, it is possible that a number of those tests are really Autocoli that's being picked up. In other words, there is cross-reactivity on antibody testing between Ota coli and between Jacana.
Okay.
Okay, yeah.
The IgG.
Oh. Hello?
That's it. Tracy, yeah.
Yeah. So, okay, so there's cross reaction between Duncani and Ota coli, but not so much Macroti, or at least they don't think so.
Right. And I'm just going by public comments from Shaw, and even Lindner has made comments that direction as well too.
And if it is Ota coli, is that sensitive to herbs, or do you need to go?
You know, I have found, your strongest way is going to be the tavenoquine-based treatment, okay? But I still have found responses in my practice for even Ota coli. With Ota coli, if I know I have Ota coli, I'm definitely going to use lumber kinase to break those fibrin nest up. But I have had success using a Cryptolepis or a Cryptolepis artemisinin approach with Ota coli.
Okay. All right. Thank you so much.
Yeah. Good luck. All right. Karen, I see your hand up there. Let's see. Karen, where'd you go? Oh, there you are. Karen.
Hi, Dr. Ross.
Hi, Karen. How are you doing?
Oh, not too badly, but can you read my question?
Oh,
See my question?
Well, I was trying to make sure, so I'm taking follow-on questions to what we've been talking about with Babesia. Is it related to Babesia or not?
Oh, no, I'm sorry. It's not, no.
Okay, we'll get to your question when I get to it then, okay?
Okay, thank you. I'm sorry. I thought we had moved on.
No problem. Okay, Mary, I see your hand up there.
So, quick question. So if you test positive to Duncani, should you test yourself for Ota coli?
That's a good question. Yeah, that's a good question. So the only lab that's doing that, though, yes, I think you can.
Right, is the T labs.
Yeah, but be aware. So the problem, T labs again is a direct test, okay? And anything, so in testing we have indirect and direct. Direct means you can see either the genetic material of the germ, like a PCR test, you can culture it, or you can look under the microscope and see it. Those are direct tests, okay? Indirect means you're looking at, is there an immune reaction? So your indirect testing would be immunoblots, Western blots, IFAs, and even ELISpots or T-cell reaction tests. Those are all indirect tests, all right? All right, the indirect tests tend to be more sensitive at finding if you have the infection in you. They have a better ability to find if it's there, all right? So for instance, the immunoblot will find the infections if they're in you about 95% of the time. All right, that's based on validation studies, okay? Indirect tests or direct testing, the problem with direct testing is that the germ literally has to be swimming by the needle the minute you draw the blood, right? So we have a sampling issue. Antibodies are everywhere. Germs are not necessarily always swimming by the needle when you draw the blood, okay? And the problem is with all of these direct testing methods, we don't actually know how sensitive they are. The labs that perform these tests do not have the data to tell us how good are they at picking up all of the people that have it. So when you rely upon a T-lab test, for instance, on the Ota coli, it only has meaning if it's positive.
Right.
If it's negative, it does not exclude having it.
I have a question.
Okay.
Got you. I understand.
Yeah. All right. Thanks, Mary. All right. Let's see. Simichek, I see your hand up there.
Yes, I want to follow up on this testing on Babesia Ota coli because I have this dilemma, and you were discussing the various tests. I have them run all, and I turn negative on fish for Babesia, but I turn positive on IFA, IgM, and IgG for Babesia duncani. Babesia fish whole blood was negative, but the IFA, IgM was positive. So can I 100% say it's Duncani, or the probability, because the fish is negative, that it is maybe autocoli?
So again, a fish is a direct test. It's a microscope test. And so it will miss Babesia in you often. Even if you have it, it may not show up on a fish test. Okay. Just so you know that. Okay. You have to have the Babesia will have to have recent. So Babesia has periods of time where it releases the germs into the blood and out into the blood, into the outside of cells, release it so it's easier to see. And sometimes it's all hidden away and you can't see it. So
that means the TLAB test might be also defective, because what if that moment the sampling doesn't have the Babesia there, the TLAB test?
The which test? The
The
TLAB. You're
TLAB
right.
test,
Yeah, no.
yes.
So both the fish and the TLAB, which are direct tests, may miss it because it isn't swimming by the needle. It may not be circulating at that moment. Okay. All right. On the other hand, the IFA is a type of antibody test, and antibodies are everywhere. They're going to swim by a needle whenever you draw blood. All right. Now the problem with your IFA test is it's Decani that came back positive, which could be you have Decani, but there's cross-reactivity on the antibodies between Decani and Autocoli, so it could also be Autocoli. So if I were treating you, and if we were treating Babesia and we get 3 to 4 months in and you're still having a lot of Babesia symptoms, I would probably definitely add in some lumbar kinase, and I would start handling your situation like you're an Autocoli.
The problem is I cannot get to that stage because my heart has a problem. The moment Aracoda is a wonderful drug. I managed 2 months and I thought, oh my God, this is God sent. And after that, my heart started to have issues and I could not continue. The heart rate and problems, swelling, it just doesn't let me. The inflammation goes out of proportion, even though I went very conservatively.
Right.
So I tried lumbrokinase.
Which is why we talked about tonight, you may need to do some more things to control that inflammation first before you go to an Arcodo again.
Mm-hmm. Thank you.
Yeah, good luck. All right, let's see. I see one more hand up here. Eric.
Oh, yeah. I just wanted to say thank you for what you do, and interject that I also tested positive for Babesia autocoli at T-Labs.
Yeah.
And happened to be negative at IGeneX. And you already answered my question because we started talking about it.
Okay, good. Yeah, good. Thank you. So again, everyone, what I would say, even no matter what test you do, they can miss stuff sometimes, okay? And that's why, especially when it comes to the co-infections, most of us providers that treat these illnesses tend to rely more on what the symptoms tell us. So if you have a lot of symptoms of Babesia, but you have negative testing, we're going to treat. And if you have a lot of symptoms suggesting Bartonella and you have negative testing, we're going to treat, okay? If you want to know what those symptoms are, I'm not going to go through them right now, but if you go to my Treat Lyme site, there's a section there called How to Diagnose. Look at the article I have on how to diagnose Babesia. Look at the article I have on how to diagnose Bartonella, and I tell you what the symptoms are that really suggest if you have Bartonella or if you have Babesia. And because testing is just not perfect, we go with what the symptoms tell us, okay? All right. Let's see. Elspeth, I see your hand up there.
Hi.
Hi.
I've been dealing with Babesia and Lyme's for a while, but I'm left with the associated infections. I'm finding it hard to clear the heavy metals. I was advised that I have to do that before I treat a serious candida overgrowth, or the candida is going to get worse. I don't know if that's correct. Binders aren't really removing the heavy metals very well.
Yeah, so what so I'll take this, but this was, you're talking more about yeast and heavy metals, and we were talking about Babesia. I understand you have Babesia. I'll take your question,
I think it's as a result of all that.
Yeah, well, let me answer it, but I just want to say to everyone, with these follow-up questions, I really want it to be about the topic we're talking about. I'll take your one this time, though, okay? All right. So I know there are some providers that say if you have heavy metal toxicity, you've got to get the heavy metals out before you treat yeast. And the reason they say that is your yeast are, if you have intestinal yeast overgrowth, the yeast can hold on to heavy metals. And if you have not gotten rid of your heavy metals and you start killing yeast, they're going to release all those heavy metals and you're going to have worse of a heavy metal toxicity problem. Okay. That's what they say. Okay. I don't buy it. I don't buy it. I don't buy it. In my practice, I have treated yeast well before I do anything for heavy metals, and I've never seen anyone get hurt by doing that. I think yeast and the inflammation it creates is a greater problem than heavy metals is going to be to the average person. So I usually will go and treat yeast first.
Would you do that with like supplements rather than antibiotics?
You could do it either way. So you could do on my, I have an article called Kills and Prevents Yeast, a brief guide. And in there, you'll see that I either recommend starting nystatin along with diflucan as a prescription option, or you can go an herbal option. And for that, I like a product called Capri Plus, and you can do a couple pills twice a day. The prescription has a 90% chance of working over 1 month. The herbs will often take about 2 months to get things under control. In that article, I also lay out the importance of being on probiotics and also the importance of being on polyphenols and prebiotics that you can get through your diet that actually support good bacteria load in your intestines too. Do you need me to show you that article, or have you seen it before?
I've not seen it before, but I've used nystatin a few times, which really worked, but the problem is it keeps coming back.
So nystatin by itself will not work. As I said, I suggested nystatin with diflucan.
Okay. If it keeps coming back, what's the best way to deal with it in my gut? I think it's just continually coming back.
Yeah, so what I would suggest before we start even getting at what do I do if it doesn't come back, try an effective treatment to get rid of it first, which is a nystatin diflucan for at least 30 days.
Okay.
All right, I know you still have follow-up questions. What I'm going to do a screen share here because I do address this in my article. I talk about what to do if your treatment's not working. And so let me just do a screen share here for you. So this is my site, my Lyme information site again, okay? And if you're ever wondering, how do I treat something, you can go to this online Lyme guide here, and there's this huge drop-down menu, and there's this section right here called yeast.
No, don't decline.
Click on that, and this is my article about how do you approach yeast, okay?
Yeah.
All right.
Okay.
Good luck to you. All right.
All right, thanks.
Let's see here. All right. Let's see. I'm going to take one more question here, and then we're going to move on to the other question. So, Mary, I see your hand up there again.
So I just want to say about the woman who was taking the tafenoquine. As far as heart issues, I always thought heart was more associated with Bartonella, and I have that too. When I started treating with the tafenoquine and the tovacone and lumbar kinase, a lot of heart symptoms, lots of heart symptoms, irregular heartbeat, heart skipping a beat. So I do think, and I'm surprised how much, I see with heart symptoms from treating the Babesia.
Yeah.
So I would stick out the treatment. It was very rough for me in the beginning with the tafenoquine, with a lot of heart issues, but they did subside, but it took about 4 months before they did. So.
But did you treat Babesia, Bartonella at the same time, right?
Yes, I did. Yes, I did. But I did heavy Bartonella treatment first, and I really treated it, heavy. And then I went on the tafenoquine and I treated the Babesia coli. And I was surprised about, Herxheimer with heart symptoms. So I think Babesia, Bartonella is big with heart, but I think Babesia is too. That's what I thought. So
I just don't have the heart issue, and now I have a fluid on the heart. Not much, but I do.
I also had that years ago. I did. I had a lot of heart issues years ago. I was hospitalized for it. So and down the line, I always thought Bartonella, but I think Babesia plays a big role there too. I do. That's what I thought.
I agree. Especially heart rhythm issues, Babesia
Yeah,
can do.
heart rhythm. I mean, I've been with a cardiologist for 25 years now, and I've had a lot of heart issues, and I think they both contribute to heart symptoms.
The problem is, it's not just as a heart rhythm. My heart rate goes so high that I'm passing out.
Yep.
So
Yep.
I
My heart rate.
cannot continue. I just simply have to, yeah.
Right. Sitting, my heart rate can go to 125.
The heart rate goes up.
Yep. Yes, and during treatment, it has done that as well.
I might go
112,
higher
125.
than that.
Yeah, treatment, I've had a lot of heart issues, and so I
It
do
only
think.
happens when I.
Go ahead.
That was about it, that every time I try to treat it, and I also question, is it because I'm really hitting hard the Babesia, or is it because something else is flaring? And since I cannot tolerate rifampin because of adrenals, I'm only taking Zithromax, and it doesn't seem to be hitting the Bartonella enough to stop the heart issues. So.
Right. Well, I treated Bartonella heavily, and but then when I went to treat the Babesia, I think heart issues go with Babesia well as Bartonella, and jumping heart rate to 200 beats per minute. I've seen it. It doesn't last long, but it jumps, and it goes, after a half an hour back to regular heart rate. But that has been a problem for me treating Babesia, treating Bartonella.
Did you take beta blockers for that?
Yes, I do. Yes, I do. And I am instructed by my cardiologist to, at that time, maybe increase the beta blocker.
Mary and Simicek, I think what I'm going to do is I'm going to ask that you guys continue this discussion, maybe through a chat with each other. Okay, because I think Simicek, she might have some good advice for you, but I think I want to try to move into some of the other questions.
Okay. Thank you.
Right?
Thank you.
Is that okay if we do it that way?
Yes, it is.
Okay.
Yes, right. Sorry, we got caught.
Well, I wrote your name down so I could message you.
I think that would be good. Thanks, Mary.
Yeah.
Thanks, Simicek. All right. All right. Let's see here. Next up, we're going to take a question from Sandra. Sandra says, I was taking crypto, hootenea, Japanese knotweed, black walnut when I took my IGeneX test. I was off prescription meds for 3 months, only taking herbs. Would those herbals affect the results of my IGeneX for the 3Bs? Thanks for your response. Yeah. So it's a good question. So the question is, should you be on germ killers of any kind? Or what are the effects of germ killers when you're testing? Okay, it depends on the kind of testing you're doing. If you're doing an indirect test, which is you're either measuring your immune reaction to make antibodies, that would be an immunoblot, Western blot, IFA, or your T cell reaction test, the ELISpots. If you're doing an indirect test, being on germ killers while and before you test actually helps the test to become positive. Because when you start killing germs, the immune system sees these dead bug parts and becomes more reactive. It makes more of a T cell response. It makes more antibodies, okay? On the other hand, if you're trying to do a direct test where you want to try to see the germ under the microscope or see the DNA of the germ, if you've killed a lot of your germs before you do the test, you're lowering the chances of that direct test coming positive, okay? So again, your direct testing would be PCR, FISH test, any of your T-lab tests, any cultures, okay? The chances of those being positive would become less if you've done anything to kill your germs beforehand. All right. Any follow-up questions there?
No, I think it was the immunoblot and the FISH test that we did for the 3Bs. Okay.
So the immunoblot would have been helped. The FISH test would have not picked it up as easily.
I see. Okay. All right. Thank you.
You're welcome. All right. This next one's from Catherine. Let's see here. Catherine says, I've been suffering with the 3Bs for years, but since September I've had shortness of breath, heart palpitations, and extremely low blood pressure. My GP sent me for an echo diastolic function assessment and it suggested impaired left ventricle relaxation, and there is mild to moderate tricuspid regurgitation. I was unaware that Lyme could cause heart issues. Have been waiting for a cardiac referral for 3 months. Who knows, once the referral has been assessed, how long before seeing a cardiologist. I want to do everything I can to offset any heart problems. I am located in Calgary, Canada, and do not have a Lyme doctor here. Have seen a doctor in Wisconsin. Naturopathic doctor cannot prescribe antibiotics here in Alberta, and my GP does not believe in Lyme and is not interested. Suggestions for antibiotics and thoughts for Lyme doctor in Montana. So, Lyme doctor in Montana. I am blanking right now. So there's not an MD, there's not a medical doctor that treats up in Montana. There is a naturopath, I believe, in Whitefish. Hold on, and I'm just blanking on her name.
It's Julie Barter.
Julie Barter. Eric, do you know Julie then?
No, but I know she's very good at what she does.
Yeah, yeah. So Julie Barter is a naturopath. And Eric, is she in Whitefish, if I'm correct?
You're correct on where she is, I think.
How do you like that? I can at least remember where she's located. I can even tell you what she looks like. I just couldn't remember her name. So yeah. So Julie Barter, I have not met personally. I have seen a lot of the commentary and comments that she gives on the iLads discussion board. I follow a lot of those discussions, and she seems good, at least knowledgeable at what she's doing. Okay, so that might be somebody for you to look into. The trouble is she's a naturopath, though. I mean, she could she would probably work herbally with you, and those are things you could do on either side of the border, basically. In terms of what for me to recommend for you, this is hard to do because I can't tell from what you've told me whether you have an underlying heart condition that's not tick-borne related, or if it is
what I'm wondering.
Yeah, I can't tell. And even if you did, you may need cardiac medications to help your heart work better so that you're not winded while you're also killing the germs too. And there will not be a good way to tell whether it is Lyme, maybe Bartonella, that's causing your heart not to pump as well. I do not think that the tricuspid regurgitation, which means your valves are leaking, would have been caused by the infections. But the left ventricular function, the ability for it to pump and relax, it could be Lyme related, or it could be Lyme or Bartonella related, but I don't know for sure. And in terms of taking care of it, yeah, you would want to kill your germs, but you may need cardiac medications, and that's what the cardiologist is going to help you decide.
What about, I know reading that there are cardiologists that are also interested in Lyme. Would that be my better way to go? Because I know here in Calgary, they'll just laugh at me at this point.
Yeah, they don't even need to know if you have Lyme because they're not going to deal with it anyhow. But they do need to do things to help you move blood better and get your heart to work a little bit better. And they can do that regardless of whether they believe in Lyme or not.
Okay.
Okay.
That kind of answers my question.
All right, Catherine. Good luck to you.
Thank you.
All right. Tracy, I see your hand up there.
Actually, it was up from the previous question about testing and being on or off antibiotics. Can I still ask a clarifying question?
Yeah.
So it sounded like you listed ELISpot testing in indirect. No. Yes. Is ELISpot any better than an antibody test at telling you if you have, been more recently infected?
So here's the thing with an ELISpot test. So an ELISpot, also called a T-cell reaction test, the way that the test is done is we take your blood, we draw your blood, then we take its T cells, we put those in a test tube, we introduce proteins from the germ we're testing you for into the tube, and we see if those T cells make certain cytokines. And the only way they'll make those cytokines is if they've seen these proteins before. Okay. Now, a T cell that circulates which is different than something called a T memory cell, which is more in your bone marrow. But a T cell that circulates has a life expectancy of 2 months.
Mm-hmm.
So if the test comes back positive, that suggests the germ has been in you in the last 2 months. Okay, all right. The problem with the ELISpot testing, though, and there's a number, is if it's negative, it doesn't exclude having the infection, even though people that use ELISpots will tell you, well, if it's not positive, your germ is gone. Well, that's garbage because we know these germs hide. All right. Also, if your germs are releasing a lot of chemicals to suppress the immune system, they're going to suppress your T cells too. And therefore you may have a low T cell reaction because the germs are partying on. Okay, so I want to caution you, a negative test does not mean the germ is gone. An ELISpot is only good if it's positive. Beyond that, you cannot make any interpretation, all right? The other problem with ELISpot testing is the two labs that do it are Armin Lab and a lab system called InfectoLab, okay? On the for Borrelia, Armin does a good job at looking at Borrelia burgdorferi, Borrelia afzelii, and Borrelia. There's another one. It's there. He does a good job at looking at the two Guerinii. So there's 2 European strains and the 1 US strain he tests for. Okay. Now, be aware that Guerinii and afzelii are actually big in the East Coast US now, too. So they're actually become US strains as well, too, all right? InfectoLab is only testing for burgdorferi, all right? So they're not testing for enough stuff. By comparison, the immunoblot method, which is an antibody method through IGeneX, is looking for 8 different kinds of Borrelia, all right? On Bartonella, as we've already said, Bartonella, we think there's up to 15 strains that infect people. The most predominant is the one that causes cat scratch fever called Bartonella henselae. That is the only one that InfectoLab and Armin tests for. They're missing the 14 other strains, okay? And then on Babesia, Armin, I believe, is only looking for Microti. He's not doing the other ones. And InfectoLab is only looking for Microti. So again, they're missing a lot of stuff, basically. Okay. So an ELISpot only has relevance if it's positive. It means the germ was in you in the last 2 months. Negative doesn't exclude the germ being in you.
Is it a more sensitive? I hear what you're saying about them not testing for enough strains, but if they kind of got their crap together and decided to do that, is it could it be more sensitive or more hopeful for letting people know if they've got something more current?
So, but neither of the labs, that is Armin and InfectoLab, have done adequate validation studies. They have not done validation studies. Armin uses a test kit that's manufactured by a different company, and he hasn't even used their kit to look and see with known samples known and not known to have it, how accurate is it at finding?
I see.
InfectoLab, I think, is the same. When you look at research on the accuracy, though, of ELISpot testing for any germs, the sensitivity runs about 85%. So across the board, lab studies tell us that for any germ, whatever germ they're testing for with ELISpot, it's going to pick it up 85% of the time. It's going to miss it 15% of the time.
Okay. All right. Interesting. Thank you.
Yeah. Thanks for your question. All right. Let's see here. Let me get rid of this one. Hello, Mindy. Let's see. What are the vitamins and minerals that Candida eats up or messes with? The prebiotic that you recommend with Candida is okay to take with SIBO. Does tick-borne relapsing fever mess with minerals and vitamins so that one could get muscle spasms? And what are the supplements you recommend for this? If burping and bloating persist despite Candida diet and treatment, what do you use for this? All right. So there's a number of questions you have there. So in terms of minerals and vitamins and Candida and tick-borne relapsing fever, keep in mind that Candida, tick-borne relapsing fever, Borrelia, Bartonella, Babesia probably are going to use the same minerals we do. they live in us, right? So they're designed to live in us, in our environment. So I know there are some people out there, some of my colleagues advocate starving, don't give magnesium or don't give sugar or don't give whatever because it's going to starve your germs. And I have to say, wow, you're going to starve yourself to starve the germ. All right. So they're going to use the same stuff we do. That's my feeling about it. And so I don't advocate limiting what you need as a means of getting at your infections. All right. That's just my own philosophy on that. All right. Second thing is, if you're still having a lot of burping and bloating after you've done a yeast treatment, there's two things. Number one, your yeast treatment was inadequate, right? And you may need to think about changing to a different regimen. Look at my Kills Yeast article from earlier tonight. You'll see I suggest a number of follow-up regimens. If your 1 or 2 month regimen didn't work, the next things you would try, okay? All right. But if you've tried the other possibility that you could have that gives a lot of burping and bloating is a condition called SIBO, which stands for small intestine bacteria overgrowth. There's also something called SIFO, SIFO, which is small intestine fungal overgrowth, which could be yeast in your small intestines, okay? So your small intestines are supposed to have minimal amounts of bacteria and even yeast compared to your large intestines, all right? And if they start growing too many bacteria or too many yeast, that becomes either SIBO or SIFO, and they cause a lot of gassiness and bloating because the yeast or those bacteria will ferment the different things that you feed them and create the gassiness and bloating, all right? The way you diagnose if you have SIBO is not a perfect test, but the test that most of us do is a test which is called a breath test. And in this breath test, you first swallow a sugar, a type of sugar, and then over the course of 2 hours, you breathe into a tube every half hour, it collects your breath, and then you send that off to the lab. And what we're looking for is whether you have elevations in hydrogen or methane or both, indicating you're fermenting stuff in your intestines because you have excess bacteria or excess yeast growing there. Okay. All right. If you want more information about how to do that, let me just do a quick screen share here for you because I have a whole article on that. Let's see here, share. All right. So, let me go back here again. SIBO. All right, so this is the article. It's about both how you diagnose and how you would go about treating it, okay? All right. Mindy, did it answer your question for you?
Yes, I just was wondering what I'm doing may not be enough if I'm doing 2 nystatin twice a day with the herbals you recommended, 2 pills twice a day. Does that generally work, or do I need to throw in diflucan, and should it be a daily diflucan or every 3 days, or what do you think?
Yeah. So if you've done a nystatin 2 pill twice a day with an herbal like a Capri Plus 2 pill twice a day for at least 2 months, and you are still having problems, then I would consider stopping either the nystatin or the Capri Plus, but staying on one of them, okay? So stay on either nystatin or a Capri Plus, and I would add diflucan to that, 200 milligrams a day, and I would do that for at least 30 days. If you've done that and you're not getting better, then I think it's time to probably do some SIBO testing.
Oh, okay. I've had SIBO in the past, but I haven't tested in many years. I've always had it though. Every single time I've tested, it's always been positive. Yeah. So I'd likely have both methane and hydrogen also.
And the methane is hard. So the methane, it's interesting. If we look at, there are prescriptions you can take, but in some head-to-head studies, some of the herbal options seem to work just about as well as the prescription options. But if you have methane producing SIBO, you're going to need to do some kind of a germ killer, whether it's herbal or prescription, directed at it for a minimum of 2 months. sometimes 3 months. And then after you've done, and you would want to also be on something called a low FODMAP diet, which is essentially removing any of the fibers that ferment within your small intestines. And you want to do that to stop feeding them. It also will help you feel less gassy and bloated. And I outline that in my article as well too. But then after the 2 to 3 months of the herbal or prescription antibiotics with methane, then you want to start slowly adding back in a healthy vegetarian diet, which is going to do a better job at supporting healthy intestinal function at that point.
Oh, so you don't like the carnivore diet for that?
Not for something like this. This is, your intestines function best with a mix, when they're healthy, of prebiotics and, I should say prebiotic fibers that you're going to get from a vegetarian or a plant-based diet.
So assuming I have all of these, and I probably do, you would say hold off on prebiotics, but take the probiotic in your article that you recommend?
So if you have SIBO, about 50% of people will do well on probiotics, but 50% of people will not. They will make them worse. So if this is SIBO, as it may be from what you're telling me, you're going to need to eventually get that under control. And probiotics may not be part of the initial treatment of it.
Oh, okay. With the muscle cramping episode, though, wouldn't that be the detox of Candida albicans because it's more of a toxic substance?
The muscle spasms could be just from having general inflammation in your body, which is being triggered by the either SIBO or yeast, or if you have tick-borne infections, or if you have mold toxicity. All those are going to trigger excess cytokines and metabolic disturbances that could lead to the muscle spasms.
Oh, okay. So is there one to start first with respect to the diet? Because I don't know if combining the Candida diet with the low FODMAP is going to go well. Like, where would you focus on one treatment first before the other?
I would, if you are certain, if there is SIBO here, I would probably start with a low FODMAP diet and focus on that first.
Oh, okay. And also take the nystatin with, say, an Alimed or something like that at the same time.
Because like an Alimed would help yeast, and also an Alimed would be an herb that could help with SIBO as well too.
Okay. All right. So just focus on all of it, because the burping and bloating is more likely to be SIBO than the Candida.
It may be. From what you just described to me based on your history, I wonder about that.
Oh, okay. Thank you so much.
Good luck to you.
Thank you.
So Mindy, and then everyone too, when I give recommendations, just keep in mind, I'm not your doctor, okay? So I strongly encourage any ideas you get from me here that you take it up with your doctor, who can decide if it's the right thing for you, okay? I just have to do that as a caveat here. I'm limited because I don't get to do the full history, and I don't get to examine you here as well too, okay? All right, let's see here. Does anyone have any follow-up questions to what Mindy just said? Let's see, Mary.
So I'm a little confused with the SIBO because it's hard to test if you're taking antifungals and antibiotics.
So the only way to test it is you have to stop those. I know. I mean,
exactly, and they want you to stop for quite a long enough time. So that's hard to test for it.
It is.
So you can't stop.
Acknowledge it. But I mean, the thing is at a point, if you're not getting better from all the standard treatment you're doing, sometimes you just have to go ahead and bite the bullet, stop things, and test for it.
Right.
I know it's not ideal. Don't get me wrong. I'm not trying to minimize that, but yeah.
Yeah, it's hard. Okay. Thank you.
You're welcome. Let's see here. Get rid of that. Hello, Marie Eve. Let's see. Hi, Dr. Ross. Can an untreated tooth infection trigger a Lyme relapse? My relapse seems to have occurred right when I got this tooth infection. and I am not sure how I should treat the infection, extraction or root canal, or could antimicrobials work? Any insider opinion on this? Okay, so let's look at what you mean by a relapse. Okay, so whenever when a person starts feeling worse after they've had Lyme, it's easy to say it's a relapse. Okay, right? But we have to keep in mind that the reason that when I'm hearing background noise.
Yeah, I'm sorry.
No, I'm just gonna mute you for a minute. That's fine. Thanks, Marie. All right, so when you have active Lyme, or you have active mold toxicity, or you have too many yeast in your body, or you have an infection in your tooth, the immune system is gonna manufacture a bunch of chemicals called cytokines. All right, it's the same thing that gets made when you have COVID too. So your response to infection is cytokines. When you get the flu, the reason you get chilled, fatigued, ache all over is because your body makes cytokines in response to that infection. Okay, so it's not clear to me from what you've just described if what you're calling a relapse really isn't just a tooth infection, giving you a strong cytokine reaction that's going to give you all those same symptoms you had before when you had active Lyme or even mold toxicity, basically.
That would be possible, that it's just symptoms from the tooth infection, but they're the same symptoms, mainly like a babesia. Those sweats that were gone came back. It could, okay.
Could be. In fact, when I have somebody in my practice that I got well, and often they might come back and see me maybe a year or 2 years later. And for Bartonella, babesia, the whole thing, okay, all of it. And I've had people come back in thinking they've relapsed. And 80% of the time, when I sat and talked with them, figured out, if they just ate a bunch of sugar right before Christmas and suddenly they started getting symptomatic or whatever it is, I sit and I talk with them. 80% of the time, I have enough clues there that tell me that it might be intestinal yeast overgrowth. So the number one cause of something that looks like a relapse is intestinal yeast overgrowth, right? Because when you make all those extra intestinal yeast, the body responds by making a lot of excess cytokines, and it can bring back all the sweats. It can bring back a lot of that stuff because your tick-borne infection, the majority of the symptoms, not all, but the majority of your tick-borne infection symptoms are excess cytokine symptoms, right? That's why COVID in some ways can look like Lyme does. And we get confused thinking, is it my COVID or is it my Lyme? It's the same idea. It's all cytokine related. Yeah.
Okay. And I guess the end of the question was, how do we treat a tooth infection? Because everybody has a different opinion on that. And I didn't know if the people, I don't know if you had an opinion, because root canals, some practitioners are against that. And
yeah.
When especially when you're chronically ill already.
No, I get it. The problem is what they're going to run into. So my opinion. Okay, so what the issue is when you have an infection in a tooth is, do you ever get rid of all of it, or can it hide out in a pocket underneath the tooth? All right. And if you do, and then if you leave the tooth in and you do a root canal to get at the infection, do you still have a pocket sitting under there where you can harbor infection? That's what the issue is. Okay.
Exactly.
Right. So in some ways, for people with chronic infections already, trying to fish around and wonder about, do I still have a pocket of infection in the bottom of my tooth, is not something you want to fight. So on the one hand, you may just want to get the tooth taken out because that's going to take care of the infection as well too. Okay. That's on the one hand. All right. On the other hand, teeth are great, man. We need them for chewing. So I don't want to just like discard a tooth that easily, right? So you could try the antibiotics first. I probably wouldn't do a root canal though. I think there's enough risk of that not going well and pockets of infection under it. But if they're willing to just say, let's try antibiotics first, the other thing would be to find maybe a biologic dentist that knows how to put some ozone or hydrogen peroxide in there, like inject it in there. That would be an effective germ killer for a pocket infection like that too. You may be able to save the tooth by doing that. So antibiotics with ozone or hydrogen peroxide into the base.
Okay, the dentist I found who uses ozone, he uses ozone when he removes the tooth, and then uses ozone to make sure all the infection is gone, but you're talking about ozone without removing the tooth.
There's the biologic dentist I used to work with in Seattle would do injections of ozone into.
Oh, okay. I didn't know. Oh, I'm in Eastern Canada. I went out, I saw all the dentists that are holistic here, but I'll check that out. I'll check it. Okay. So antibiotics, then ozone, and then last resort, removing the tooth.
That's why I probably, if you want to save that tooth. Yeah.
And
Especially if it doesn't work, if you don't get better and you're still, you treat the tooth and you're still feeling like crap, it could be that is still a pocket of infection here.
Yes. And then root canals is not a good idea. That's what I get from.
I would agree.
Okay.
Yeah.
Thank you.
All right. Good luck to you.
Thank you.
All right. Let's see where we are here. All right. All right. Hello, Lisa. Let's see. Hi, Dr. Ross. My daughter is attempting to get on the full Babesia protocol of tefenaquine, atovaquone, and azithromycin. She hasn't been able to get past 250 milligrams of azithro every other day without her vertigo, head pressure, and headaches increasing significantly. She started low and slow on November 11th with tefenaquine alone for a few weeks. Then, in your opinion, should she push forward, stay here, or pivot to another antibiotic? She also has tick-borne relapsing fever, and it's my understanding that the azithromycin would target that as well, but would like clarification. Many thanks. By the way, I'm not on camera because I am so sick and no one should be. Lisa, I appreciate your sparing us, but we would have been fine having you on camera.
You say that, but you haven't seen me, so.
All right, so I clarify. What dose of tefenaquine is she on now?
300 milligrams once a week.
Oh, okay. So she got up to a pretty good dose on that. How old is she?
26, and she's about 110 pounds, very muscular.
Okay. So you may be running into a side effect of the azithromycin giving her the vertigo and the head pressure. All right. It may be more side effect related. What I would do with a patient of mine that was in this situation is I might stop the azithromycin, realize that it'll take at least 7 days to get out of her system. Okay, it has a very long what's called a long half-life. Okay, once that is out, you might try another member of that family. They're called the macrolides. And the other member of the family that likely is going to do just as well as the azithromycin for both tick-borne relapsing fever and for the Babesia is called Biaxin, also known as clarithromycin. And I would, a full adult dose for her would be 500 milligrams twice a day. But you might want to start at 250 milligrams twice a day and see how she handles that.
Thank you. Would that also be a little bit more gentle on her gut? She has a lot of gut symptoms, but that predates the antibiotic.
It can be, not always, but it can be, yeah.
Okay. And I just wanted to clarify also her head pressure and the headaches and so forth also were part of her Babesia's symptomology.
I realize that, but the vertigo is not necessarily. So I would wonder about a drug or a side effect, I should say.
Okay, gotcha. Thank you.
All right. Good luck to you.
Thank you so much.
Good luck with your daughter too. Yeah.
Yeah, thank you.
All right. All right. Well, listen, everyone, I think that's it for me for tonight. That's it for us for tonight, I should say. So keep your eye. Next week, I was supposed to be at a retreat that I think I'm not going to now. So even though I'm not currently scheduled for a Conversations with Marty Ross MD, by tomorrow, I'm going to make a decision as to whether I'm going to have one next week. So I may have one next week. If not, our next one is in 2 weeks, and it's a morning one. We're doing it in the morning so that some of our European members and some of our Middle East members have a better chance of being able to participate. Okay. So anyhow, tomorrow morning, when I announce that the recording is ready, I'll let you know what we're doing with the next webinars, and I may add one next week. All right. And so look for that between 9 and 9:30 a.m. tomorrow. All right. All right. All right. Goodbye, everyone.